Hi, I'm Jonathan Piccini from Duke University, and this is Heart Rhythm TV. And I'm very excited to have with me today Dr. Sean Pokorney, who is the lead investigator for the AFib Centers of Excellence Heart Rhythm Society COMPASS program on early rhythm control. It's great to have you here, Sean.
Great. Thanks for having me. It's great to get to highlight this important program.
And so part of the reason we're highlighting this program is it's AF Atrial Fibrillation Awareness Month, which I suspect the vast majority of our audience knows about, but maybe not all of the audience. And obviously, atrial fibrillation is a huge problem. It's going to affect 1 in 4 Americans over the age of 40 and affects more than 33 million people worldwide. And so the Heart Rhythm Society has recognized the critical importance of caring for persons with atrial fibrillation. And COMPASS is a very important program within the Heart Rhythm Society's Atrial Fibrillation Centers for Excellence program. So my first question is, Sean, what is COMPASS and what is the Early Rhythm Control program?
Fantastic. Yeah, thanks for asking. So we're really excited to be focusing on early rhythm control as the first implementation program within COMPASS. And so COMPASS is really a targeted effort to come up with care pathways within health systems. And it's using a combination of things such as EMR integration, data measurement and feedback from the EMRs. It's designed to come up with education initiatives within health systems that can ultimately deliver care pathways and improve the quality of care that our patients receive. And for the first program, we've decided to target early rhythm control with all of the data from EASD-AF-NET4, STOP-AF, other research platforms that have come out. We certainly all appreciate that early rhythm control is critical for our patients, and we think that we're missing an opportunity to get to those patients early on. And so we're using COMPASS and the tools that exist within the EMR to identify patients early in their disease course and make sure that we can hopefully intervene on those patients and get them the care that they need. And that's going to include a couple of things. It's going to include getting them consults with cardiology and electrophysiology. It's going to include targeting early rhythm control initiatives such as antiarrhythmic medication and ablation.
That's great. And I guess I'm taking by the language you've been using that unfortunately not everyone is afforded an opportunity to see a specialist. Not everyone is afforded the opportunity to learn about early rhythm control and to potentially receive early rhythm control. What do we know about that out in clinical practice?
Yeah, so unfortunately, what we've seen is that there's some historical data that exists from a firm, for example, that's really led, especially the general cardiology community, primary care community, to de-emphasize the importance of rhythm control, because I think historically it's perceived to have not been of great importance. And really what shifted that was the data from EASD-AF-NET4, which demonstrated that when you took patients who were diagnosed with AFib within the last year and you randomized them to a rhythm control strategy within that trial done in Europe, primarily an antiarrhythmic medication strategy, that the patients that were randomized to rhythm control actually had a reduction in the composite of cardiovascular death, stroke, and cardiovascular hospitalization. And so, I think that the messaging around that has not really percolated out through all of clinical practice yet. And so that's really the key and the focus. What we've learned so far from our early initiatives and early components of this COMPASS program within early rhythm control is that there's certainly a minority of patients that are being identified and triaged appropriately.
Okay, so we know that early rhythm control is critically important. We think it should be an opportunity that every patient should receive. It just shouldn't be for those who are lucky enough to see an electrophysiologist because of where they live or the way their health system works. The goal is to get everyone an opportunity to receive early rhythm control. So how does the program work? Where is it being piloted? What actually happens in this program to get improvements in early rhythm control?
Yeah, great question. So we're fortunate enough to have key sponsorship from Sanofi and some additional sponsorship from Johnson & Johnson, Biosense Webster to support funding for a demonstration program in 3 separate centers. And so the 3 separate centers are at Duke University, at Cedars-Sinai with Rupi Sandhu, and at an HCA hospital with Andrea Natali. And so within those 3 centers, what we're actually going to be doing is we're going to be looking retrospectively over the previous 6-month period at what portion of patients who were diagnosed with AFib within the last year within the EHR coding. And we're going to look at what percentage of those patients actually received rhythm control. And then we're placing an intervention within these 3 centers, mostly targeted around education, awareness, and development of care pathways, and then some measurement and feedback within the electronic medical record. And then we're going to be doing a prospective viewing of what the percentage of patients are that get early rhythm control over that subsequent 6 months after the intervention. And there'll be a pre-post comparison within those 3 institutions.
Okay, so there's some provider education, there's some patient videos to help educate patients, and then there's a care pathway. Now, is this a top secret care pathway, or is the idea that this is going to become a community resource that folks can go to the HRS website and access and use in their practice?
Yeah, absolutely. So thanks for highlighting that. So one of the key components is that within Compass, we want to integrate this within the heart rhythm patient pages and the heart rhythm website. And so all of these resources are resources that are available, the patient videos, the provider videos, as well as the care pathway.
So if I'm at a hospital and I'm interested in building my AF center, this is a program that I can use as a resource. Is it just going to stop at early rhythm control, or is this just the first act in the grand scheme of things?
Yeah, so this is hopefully the first of many, and Heart Rhythm Society has already lined up a series of initiatives. This was just prioritized as the first and most important to start with, and I think that we're really excited for what we're going to learn in this project in terms of identifying patients within the EMR, working across different health systems. And I think we'll be able to leverage that into future projects.
Well, that's great. So I've certainly learned a lot. It's great to understand that this Compass program is accessible to the whole HRS community, and it's already led to a lot of great things, including some of the patient videos you mentioned that are available at Upbeat. If you haven't gone to the Upbeat website, I highly encourage you. The videos are fantastic. They're a must-see and must-have tool for any AF clinic. And hopefully what we'll see is that this program is going to help us achieve the vision that every patient has an equal opportunity to early rhythm control and its benefits. And thanks to you and all the Compass investigators for making this a reality. And we look forward to having you back on Heart Rhythm TV to tell us all about the results.
That's great. Thanks so much for having me, and happy AFib Awareness Month.